Yeah, great, thanks. So before we sort of jump into the questions and do some introductions, just a couple of things by way of ground rules. I don't know if you noticed, it's probably a very perceptive group based on what you do, but there's a camera here and a mic at the end of the table. And the purpose of that is twofold. One is that part of a listening tour, you want to spend this time listening, not sort of taking notes. There's other people who want to hear what you have to say who aren't in the room right now. So the primary purpose for the recording is actually so we can sort of keep that and go back and refer to it and transcribe it and things like that. The second piece of it is that we don't expect to sort of reveal sort of what we've learned from this process by coming out with a long paper that says, here's what we think and what we heard. Instead, we want the voices of those people who we met with to be represented. So in some cases, there's audio recordings, in some cases video, and we'll be taking those to basically create small packages that we can share with the community, like an event that we'll talk about a little later, a population health summit that's being planned for April of next year. So with that said, we want you to be open. If there's anything that you say during the course of this that you're like, hey, I don't want this shared, then let us know. When we use you, if we do in any pieces, we'll share back and make sure that we are fine with how your words are being represented and things like that. And you'll see that there is a consent form, which is really great. Some people signed it without even knowing what they were signing, which is a great level of trust. So thank you. So if you have any objections, please feel free to let us know. As Steve sort of mentioned, it is this sort of idea that Cottage Health has acknowledged that so much of what happens and impacts someone's health happens beyond the walls of their hospitals or any of their facilities. It happens out in the community. So these events are critical to understand sort of what you're seeing and what you're hearing. Just to give you a sense of the kinds of groups that we're talking with. We're talking with people who work in government, who work in business. Later this afternoon, there's a meeting with clergy members. We are talking with groups, obviously there's a robust nonprofit sector in this community, and we're meeting with not only the people who run those organizations, but the people who benefit from the services. So we're actually going out and sort of like observing and talking to people who are represented by that. The other thing too, in addition to sort of this kind of qualitative research, is there's a large quantitative survey that's being fielded as we speak out in the community. So Cottage Health will get a real robust amount of data that basically has community members themselves telling us what some of their health needs are and some of their concerns, et cetera. As we sort of hear from you today, one thing to sort of keep in mind, while it would be great if you were sharing sort of any sort of your experiences in the context of data or whatnot, that's wonderful. But we also want to hear stories, like stories that you have experienced in working with members of the community, things that have led to frustrations or opportunities. And the final thing I'll just sort of add is that this came up last night. Sometimes you have these groups that you feel like a bit of a Debbie Downer. We know that there's so many wonderful things about living in Santa Barbara, that there are so many wonderful things that make actually health possible for so many people. And we'll talk a little bit about that. But we also want to sort of make sure that we are talking about the issues that people are dealing with and what those barriers to those are. So with that said, if we could start just by doing introductions, we'll start with Bob. And if you could go around and just sort of say your name, how long you've been in Santa Barbara, what you do here, and then just a quick statement on what, from your perspective and your work, a healthy community means and looks like. So when you think like, wow, I would love Santa Barbara to be more healthy in this regard, or this is something that they're doing great, that'd be a great way to sort of start the conversation.